Hello everyone, myself Dr. Arun H.M, Consultant Pulmonologist, Narayana Multispeciality Hospital, Mysore. Today we have Dr. Lokeshwaran, Consultant Pulmonologist, Narayana Multispeciality Hospital, Mysore, and Dr. Suhas Consultant Oncosurgeon. Today we are observing the World No Tobacco Day. So today, the May 31st, every year we observe World No Tobacco Day in order to create awareness among all communities globally regarding the harmful side effects of tobacco. So this year the theme of No Tobacco Day is Protect the Environment. So today we shall discuss regarding the what is tobacco, what are the forms of tobacco, what are the harmful effects of tobacco, so on how we should overcome this burden of tobacco and its disastrous effects. So first we'll go to Dr. Lokeshwaran. So he'll be telling about what is tobacco and its forms.
We observe World No Tobacco Day every year, May 31st, since 1987, which was included by WHO associated countries to highlight the awareness of consumption of smoking on people, public health, and their and community and environment. So, tobacco is a green leafy plant that is usually grown in the warm climates, and it is usually dried up and then used in three forms. Usually 10% of the world population take it in the form of smoking, and rest of the population, like around 18 to 20% of the population, will take it in the form of tobacco chewing, and very little percentage of the population will take it in the form of snuff. We call it as nasal sniffing. See, active smoking refers to the person who is smoking. Second-hand smoke refers to the person who is stand next to him and smoking the same smoke. And when it comes to third-hand smoke, the products are byproducts of smoking which cling to the fabric or the household linen, which will inhale further, will contribute to the third-hand smoke. When it comes to the burden of tobacco consumption, so globally we have around 1.4 billion smokers present around globally, and out of this, when it comes to India, which is the second highest producer, second highest consumer, and second highest exporter of tobacco, we have burden around 12.8 lakhs mortality annually. Globally, we see around 8 million deaths every year, including the cancer cases. Of quitting smoking, your BP and pulse rate will improve, and within hours of quitting smoking, your blood levels of nicotine will be better, and within months of, say around 3 months, where your pulmonary function test will be improved. I mean, pulmonary function will be improved, and if you take long-term goals, if you in the 5 to 15 years of period, your chances of getting lung cancer or heart-related diseases will be equal to a non-smoker. So this year our theme is protect the environment. This emphasize how production of tobacco and how it affects the soil fertility and how it affects the crop in the same plant, same crop.
Like we know, tobacco contains more than 4,000 toxins in it, so both carcinogenic and non-carcinogenic. So among them, important ones are nitrosamines and carbamino compounds, benzene, pyrene, cyanide, and important toxin is the nicotine. So it causes various health effects, health hazards. So almost all organs in our body are affected by the tobacco. So if you go by systems, so regarding the onco part, Dr. Suhas will be enlightening us regarding the harmful effects of tobacco.
Tobacco, whether it is chewable form or the smoking version of it, has been known to be associated with around more than 20 different types of cancer. So majority of the preventable causes of cancer, what we call, which we can definitely reduce the numbers, reduce the incidence of it, is contributed by tobacco chewing, by the tobacco chewing. So once the causes of this tobacco, sorry. So, important point about tobacco and its harmful effects is that it is the most common carcinogen in our body. So, nearly it contributes about 20 million cases all over the globe in cancer causing. And these cancers can affect various organs, starting from the oral cavity to the urinary bladder, and these are all considered as preventable cancers. Now, when we talk about the cancer part, the most important point is the duration of the tobacco usage, whether chewing of tobacco, which is most common in India, in the form of gutka, kheni, or even the leaves, betel leaf nets. So these are the most commonly used things. So these causes the oral cavity or the oropharynx, the back of the tongue cancer, and the voice box cancers. So it's more prevalent in northern India, where the habit of tobacco chewing is very common, and it starts early in the life, and the numbers are quite high. Whereas in southern India, when it comes to the picture, it is most commonly is the smoked tobacco, and the smoked tobacco in that sense causes the other types of cancer in more common than the oral cavity, like the lung cancer or the also causes urinary bladder cancer, and pancreatic cancer has also been implicated. Now, the carcinogens, as elaborated by Dr. Arun, the important things about carcinogen is the duration of the impact. That means how long one person has used this tobacco for. So this is calculated in the form of smoking index, which gives us an approximate estimate, like how long he's been smoking and how much of the tobacco he has consumed over these years. You see, the higher the number, the higher the chances of cancer formation. Now, when we talk about the duration of the cancer, so the stoppage of tobacco usage at the end, it does not make the risk to zero, but over a period of time, it definitely reduces the chances of cancer forming. And when the patient has had the cancer and continues to use tobacco or smoking, the chances of recurrence or the chances of second cancer also increases. So the most important point when we think of cancer and its association with tobacco is that first thing, the treatment has to be done correctly. Second thing, cessation of the tobacco smoking is very important to ensure the chances of cancer coming back is reduced. So when we consider the treatment part of cancer, the tobacco as such, for example, when you consider oral cavity cancer, the evaluation is different with regards to other cancer, is that we check the entire organ to be sure that it is the only source of cancer, because there is a chance that there will be asynchronous, that means to say another cancer which is in an associated organ. For example, patient with oral cavity cancer can also have a cancer in the oropharynx, which is the posterior part of the oral cavity. This is because the smoke which is inhaled can cause effect on various organs of the body. So the evaluation of the patient when the patient is a known smoker includes the systemic evaluation to assess the other organs also, so that we do not miss the treatment at the first setting. Second thing, treatment, as I mentioned, is similar to whatever the other causes of the cancer is, and once the treatment is done, the follow-up includes regular checking, which is about every 3 months, and then complete cessation of tobacco, which is very essential to make sure that the cancer doesn't come back. So once the cessation is done, then the chances of coming back are reduced. But that does not mean that if the person has stopped tobacco, it does not ensure that he never gets cancer. But at least the risk is decreased, and a regular screening is essential to ensure that the cancer patients are treated properly. So in a person who is not yet get cancer, but there is a high risk because of the inhalation of tobacco. As such, in India, there is no guidelines to have a regular screening program, but definitely these patients who have had a substantial amount of tobacco intake should have screening with an oncosurgeon to check up with the oral cavity, so to ensure that there is no malignancy. And second thing, in those patients who have had smoking index higher, those patients can be offered a a low dose CT, which will tell us if there, even with the lung cancer, if it is starting in the early stages. That's because lung cancer per se will not have symptoms till the advanced stages, and hence majority of the patients, nearly 70 to 80% of the patients who come to us for lung cancer treatment are already in stage 4 disease. So the detection is delayed in majority of the cases, and hence proper screening programs should be added on to these patients. So if detected early, definitely the cancer is curable. So detection is very important in these patients.
So now we got to know about various cancers caused by tobacco. So now let us see the other effects, other hazardous effects of tobacco chewing or smoking. So first thing is like immediately what can happen is the increase in the heart rate. There can be elevation in the blood pressure. There can be increase in the respiratory rate. There can be feeling of like immediate cough, production of sputum. So all and feeling of breathlessness. So these things can occur with immediate effect after starting smoking. So other effects like the predominant systems involved with tobacco chewing or smoking. So the next thing would be the respiratory system. So and then the cardiovascular system. So in respiratory system, the important thing is development of COPD. So what we call it as emphysema. The toxins in the tobacco can cause destruction of the lung parenchyma, which will lead to permanent respiratory damage. So which will lead to breathlessness, which may stay for lifelong. So and other than this, there can be like acute effects like pneumonia, bronchitis, and bronchiolitis, and there is also an increased incidence of tuberculosis in people who smoke. So coming to the other systems, the cardiovascular system, it increases the risk of myocardial infarction or the heart attacks. So the tobacco causes thickening of the blood vessels. So this in turn lead to sluggishness of the blood flow, and later on lead to platelet aggregation and thrombosis. So this can cause heart attack. So in the central nervous system, the blood vessels supplying the brain, so the same pathogenesis which will cause occlusion, narrowing, and obstruction of the blood vessels, causing stroke. So and then we have also observed that in tobacco users, the lipid profile will be deranged. So there will also be like uncontrolled diabetes, and also increased prevalence of diabetes in people who smoke. So and again there can be uncontrolled hypertension in people who smoke. Pause. So apart from vascular and respiratory system, so other systems include would be musculoskeletal system. So we see increased incidence of fractures in patients who are addicted to tobacco. So and then the issues of gastritis, ulcers in the foot pipe, all these things we see more in people who smoke. So and again coming to the reproductive system, especially in the females. So now we are seeing more number of women are getting addicted to the tobacco smoking. So during the pregnancy, there is an increased chance of fetal loss, abortion, and then development of intrauterine growth retardation, so and babies with anomalies. So we are seeing increased incidence of these in case of pregnant females who smoke. So and coming to the incidences, like we see heart attacks 4 to 6 times more in people who smoke compared to the non-smokers. So and again similar in cases in case of stroke, so 2 to 4 times higher risk than non-smokers. So lung cancer in men, the incidence goes up to 25 times more than the non-smokers. In females, the risk of lung cancer goes up to 15 times than the non-smokers. So as I told earlier, the definitive cause for COPD is smoking. So almost all people who smoke sooner or later they tend to develop COPD.
The key message of this World No Tobacco Day, May 31st, 2022, emphasizes on how we have to protect the environment from smoking tobacco or production of tobacco. So with a key role of how tobacco harms the environment, how the lands become barren with the production of high production of tobacco, and how it reduces the fertility of the soil, and how it yields the it hampers the productivity of other crops in the same land. And these tobacco products, consumption of products causes release of about 84 megatons of carbon dioxide every year, which added to the greenhouse gases. Around 3.5 million hectares of land was deforested every year because of the additional production of tobacco throughout the world. Even though we have developed a framework convention on tobacco control in 2003, but still none of the countries follow the protocol. And even though we have COPTA Act to control the tobacco and related products, and it's barely followed in India. So it's our responsibility, our politicians or policymakers, to act or make a policy to control the production and consumption of tobacco-related products, so we can save the future generations.
So far we went through various hazards of tobacco addiction and smoking. So already like you are a smoker, so what should we do now? So it's always better to get annual health screening to look for harmful effects of tobacco. Like for example, in COPD and those people with long-standing cough, with sputum production, breathing difficulty, it is always advisable to consult your doctor and to get your radiological imaging and pulmonary function tests. So now after knowing all these hazards, so now you know the benefits of quitting the smoking. So you may ask, like I smoked for 10 years, 15 years or more than that, so what will happen if I quit immediately? So if you quit, definitely there will be nicotine withdrawal symptoms, like you may get irritable, anxiety, sleeplessness, there can be increased appetite. So all these things can be observed. So especially the severe symptoms can be seen in first 1 or 2 weeks. By over 4 weeks it will come to normal. So we always advise, like those who are smoking like more than 1 pack per day, so all these cases usually we say to quit slowly, to reduce over weeks. So whenever a person comes to quit smoking, so there are 5 A's. So ask, advise, assist, assess and arrange. So we ask like how long he is smoking, so and then whether he is mentally prepared to quit smoking. So we'll assess, so and what are the risk factors he has, like whether he can quit or not. So then, and we'll advise, we'll give him the options, like what are the options for quitting the smoking, including like nicotine replacement therapy. So and we'll arrange for that, and whenever he comes for follow-up, we'll reassess the progress. So now we'll just like what are the forms of nicotine replacement therapy. Nicotine, we are giving a clean nicotine, so just to prevent the withdrawal effects. So this can be in various forms, like gums, patches, lozenges, intranasal nicotine. So these are the various forms of nicotine available. Other than this, the other pharmacotherapy includes bupropion or varenicline, so which we always give after psychological counseling of the person. So far we discussed about like what is tobacco, what are the forms in which it is used, and also the hazards of tobacco, and like this year's theme. So we are discussing about the present year's theme. So to protect the environment. So we all will pledge and tell that, say no to tobacco. To protect the environment, like Dr. Lokeshwar said, so we should try to cut down from the tobacco cultivation itself. Again, it's a big harm for the farmers who are growing tobacco. So the government should make alternatives for them, like apart from tobacco, what else they can grow in the tropical climates. So this should be done. And again, the industries. So the industries, tobacco manufacturing industries, so they are letting in a lot of pollutants. And again, from the consumer point of view, so the burnt out cigarettes are thrown everywhere. So this will add up to the this will also cause environmental pollution. So it's our responsibility to again with wholeheartedly tell no to tobacco. Also, as Dr. Suhas briefly described about various cancers caused by tobacco, and also like how to prevent it. So we all should ensure again, once again, say no to tobacco. I thank Dr. Lokeshwar and Dr. Suhas for joining in this program for creating awareness to help public to say no to tobacco. So, and also I thank for all the audience for patiently listening to us. Thank you.